Hello friends, I'm Dr. Vijay Pillai, Consultant and Chief of Head and Neck Surgical Oncology at Narayana Health, Bangalore. Now, it's a common misconception that only smokers can get cancer. It's not necessary that all smokers would get cancer. It's basically a person's genetic predisposition and the fact that there would have been changes, what we call mutations, which lead to the progressive accumulation and then result in cancer. There are smokers who would not have any cancer. But in general, people who smoke have been known to have oral cancers, voice box cancers, lung cancers. But we also see a lot of patients who would not have had any of these risk factors. It would have been just a sharp tooth, or it would have been just a small white patch which has rapidly progressed, become red, and then transformed into cancer. So remember that there are certain risk factors, but there is equally a population at risk who would not have any of these risk factors. So it's important that any of the concerning signs and symptoms are not missed, and basically a specialist opinion is taken at the earliest. It's a common myth, or I would say a fallacy, that if you do a biopsy, the cancer spreads rapidly. There are certain head and neck cancers we would never recommend a biopsy. For example, something from the salivary gland, because we say that it might seed the cancer. So you have non-invasive techniques like probably doing just a fine needle aspiration cytology or maybe a true cut biopsy. But for other cancers, a small bit of tissue which can be taken would definitely not cause the cancer to progress or to seed it or increase. But having said that, once the diagnosis is made, it's always recommended that you should not wait for too long. Do not wait for the growth to increase in size and then attribute it to the biopsy. There are certain sites in the head and neck region, like for example, swellings in the neck, which we call lymph nodes, where we would never want to do a biopsy. Rather, we would want to do an aspiration of cells called a cytology test, or even in case of a thyroid gland, where we would do a cytology. So there are certain indications where a biopsy is preferred. There are certain indications where you would want to do a cytology. But please remember, a biopsy does not cause a spread of cancer. A common concern among patients when they're diagnosed with oral cancer is they do not want to undergo surgery. It's very understandable because the mouth and the head and neck region is something that a person presents to in society. Is always concerned how mutilating would the surgery be? How morbid would it be? Will he ever return back to society with his normal form and function? Can he speak? Can he eat? Would there be scars on the face? But friends, please remember, for oral cancer, the best outcomes are always with surgical removal. Medicine has evolved. Similarly, our specialty also has evolved, keeping in mind these concerns. Surgeries are done with very small incisions. Surgeries are done with minimal scars on the face, head and neck area. Surgeries are done to minimize the morbidity and to enhance the functional recovery. Good reconstruction with basically bone, with good soft tissue, can sort of rehabilitate the patient to almost a near normal function with proper treatment. People can have teeth back, people can eat by mouth. It's just the fact that you need to be motivated during the course of your cancer treatment. Cancer is never a death sentence. I think that's the first thing that I would emphasize to all my patients, to all the people who have been afflicted with cancer. Cancer survivors who have gone through the whole stresses of treatment would always say that cancer is never a death sentence. You need to be strong. It's a problem that can affect anybody. With good treatment, you can overcome it. There is hope.